Hi, I'm Carly, and I chose to do this on verbal operants, but more specifically on responding with yes and no to verbal operants, or with the verbal operants. So to start out with the background of verbal operants is Skinner's basically the one that founded it when looking into verbal behavior. He suggested that verbal behavior should be characterized not by the response form, but by the functional characteristic of the behavior. And with that, he assumed that topographically similar responses may be functionally independent, which led to him finding four verbal operants that are applicable to the assessment of teaching language to children that have a deficit in language. The four verbal operants are mand, which is a request for a specific MO. So if you have a child that's thirsty and wants juice and they say, I want juice, they are manding for the juice. Attacked is a label that occurs in the presence of a nonverbal stimulus. So if a child sees a dog walk by and points and says dog, they are labeling that dog or attacking the dog. An echoic has point-to-point correspondence and is when the child emits the same exact spoken response as given. So if you're working with a child and you say ball and they repeat ball, that's an echoic. An introverbal does not have point-to-point correspondence with the response and is occasioned by a verbal stimulus. So it could be answering a question, filling in the blank to like a song or something. So if you're singing Twinkle, Twinkle, Little Star with a child and you say twinkle, twinkle, and they say little star, that would be the introverbal. So now moving into using yes and no responses with verbal operants. It's a basic language skill and it helps convey personal feelings or preferences for the child. Children typically tend to respond with yes, no to mands, but not tacks, and that's because the man directly benefits the speaker. And one of the studies that I looked at found that mands and tacks are easier to teach and more acquirable than introverbals. This is because, again, the mands directly benefit the speaker. Um, Tacks provide both the visual and verbal antecedent when the speaker can relate to with that, so they can hear it and they can see it, whereas the introverbal only uses a verbal prompt, which can be more difficult for the speaker to grasp because they don't have like that visual aid to help them understand. Um, with and the same study also found that children responding with yes, no did not generalize to other items in the house. When one behavior sorry. So the same study found that the children tend to respond with yes, no, were able to generalize it to untaught items, but they were not able to generalize between the verbal operants, which goes back to how Skinner found the verbal operants. So the articles that I chose are evaluation and training of yes, no responding across verbal operants, and establishing generative yes, no responses in developmentally disabled children. So whenever I chose these articles, I looked at the university's database and more specifically, I looked through the Journal of Applied Behavior Analysis. I did this because I knew the articles would relate to the field, and the JABA is a credible source and make sure that the articles are peer reviewed. And then from there, when I was specifically looking at the studies, I made sure that the studies were applicable to verbal operants, and I made sure that it had at least 3 participants to make sure that the study was valid, and I made sure that the participants were young children so that it related to early intervention. In the first article, which is the Alice article, there was a functional relation between the independent and dependent variable. There was not a functional relationship between the between teaching the no manned condition, but other than that, for all the other conditions, including the like responding with yes demands, responding with yes and no to tasks and interverbals, that all had an independent, all had a functional relation between them, both when for taught items and after when it was generalized to untaught items. And they know this because they did not respond, basically corrected all, like on the graphs it was 0 during the baseline phase, but when then like the treatment had been in session, it had gone up and it was effective because there was no overlapping data points. The trend was up and they pretty much shot up like almost straight to 100 almost immediately. The strengths of this article are that it was a multiple baseline design. There were 3 participants which were diagnosed with ASD. It explained the setting of being held in a classroom. It listed the dependent variables with definitions of the man baseline probe session, the tact baseline probe session, and the manned, the tact, and the interval, and what they were defining it as with the yes-no. It listed the independent variables with definitions of correct and incorrect responses with yes and no. And it also it explained how the IOA was implemented and that the mean count IOA was at 99.6, 100, and 99%, which were all above the 80% criterion mark. The target of responding with yes, no is socially valid, and it explains why in the beginning of the article. And it's basically because it helps children communicate their preferences. Participants correctly responded with yes, no within each verbal operant after training, even to items that were untrained, which supports Skinner's hypothesis of functional independence of verbal operants. And the research was consistent with previous studies on the topic. The limitations of the article are that they were unable to teach the no mans because one of the participants, Gary, kept responding with yes to a lesser preferred food, and another participant, Chuck, kept trying to eat the lesser preferred foods, which was probably due to the fact that they are providing lesser preferred foods rather than non-preferred foods completely. The no man sequence was then left out of the study for these participants due to the time constraints. And future condition, they were talking about how future conditions should be tested with the no man sequence and having it taught properly. Generalization of untaught items were assessed, but the generalization of the natural environment was not assessed. So the true effects of this study would have been shown more if the generalization of the setting had been assessed, and it would show if they were able to make more spontaneous yes, no mans or responses in general. The results of the study showed that the no mans did not reach mastery level for 2 of the 3 participants, clearly due to them not being able to teach it and how it was removed of the study. But other than that, each participant reached mastery for all of the other targets after training was implemented and was able to generalize their responses towards untrained items. So the next article is the Neef, Walters, and Eggle article, and the functional relationships between the independent, and there was a functional relationship between the independent and dependent variables between the number of correct responses for yes and no in the instructional phase. And there was not a functional relationship between the number of correct responses for yes and no during the tutoring phase. The strengths of the of the article are that it was a multiple baseline design across participants. They had chose 4 participants with developmental delays like with ASD-like behaviors, or they were actually diagnosed with ASD. They described the setting of the experiment and how it was held in a classroom. They listed the dependent variables with definitions of the embedded instruction probes, embedded instruction, the embedded instruction, the embedded tutoring probes, and generalization. They also listed the independent variables of correct and incorrect responses per demand placed. It explained how IOA was implemented and it was at 100% agreement rate, which was above the 80% criterion mark. And the study provided a baseline phase for each treatment. The target of responding with a yes and no is socially valid because it helps the children communicate their preferences. It implemented instructional control condition when the tutoring condition did not work. Whenever they saw it wasn't working, that's when they then changed it and added the instructional control phase, which helped improve the treatment. And the participants were able to generalize responding with yes, no, manding for the do you want question outside of top items, which was also pretty cool. The limitations of this article are that the participants did not generalize with yes, no, responding with tax to is this a question, and the students did not improve during the tutoring phase of the experiment or respond correctly. This phase was not effective in teaching responses with yes, no. The results of the study showed that the percent correct responses during tutoring for students 2 and 3 varied inconsistently, whereas 1 and 4 typically perseverated with a yes response, resulting in half of the trials scored as correct. When the instruction retrieval phase was implemented, though, performance improved for all 4 participants. The participants all reached mastery during this phase for both a manned question of do you want and a tact or intraverbal question of is this a. The participants were all able to then generalize these skills to other items and even generalize the tact intraverbal questions involving actions and possession. So the effect that this like looking at these articles will have on my practice is that when a child has limited verbal behavior or is nonverbal, I will make sure to teach them how to respond with yes, no, to start with, since it is a basic language skill, because anyone can respond with this, even if it's with a head nod or if they have a device or pecs or if they are verbal and can say yes or no. Mandating with yes and no will be prioritized for what I just explained. This will help them expand their ability to communicate their needs and will help reinforce them like wanting to speak and from getting so frustrated when they can't express their needs at all because they don't have the responding with yes, no in their repertoire. When teaching this, I will apply this to my practice by teaching the skill of responding with yes, no, and similar tactics that both of the studies used, and will be used when training yes, no responses. So one of the studies did a free operant preference assessment when figuring out which preferred items to teach yes, no for. And I will do that because that helps know like all of the preferred items that the child will be interested in their own environment. The mands will be taught first because it directly relates to the child and motivates the child by responding with that. And then I will follow that by teaching tax and intraverbals with yes and no. When teaching these verbal operands of yes and no, I will use echoics when training to prompt the answer, and I will slowly faded out. What will I do differently from the studies that shown? So when I'm doing that, I will work in a different generalization plan than they did, because both studies only generalized untaught items versus the setting. So I will make sure that I work on setting generalization with the children as well, so that we're able to get more spontaneous yes, no, and just expand that skill. When no man's with no man, like responding no for man's, I will make sure to use non-preferred items so that it's more successful and the child is actually able to discriminate that no, I do not want this item, and to make that difference of responding no compared to yes. And that is it. Awesome. Thanks.